Okay, now straight to our in-studio guest this morning with our Let's Talk segment. As you know, we had mentioned earlier on that today is World Lupus Day. And this is something that we're not too familiar with. We had spoken about it earlier on that we did have an in-studio guest who came in earlier on in the year, just to talk about her fight with lupus, and of course it affected other organs in her body. But that was actually the first time it came to my attention. So I'm glad that this is marked internationally every year, and today World Lupus Day. So Mavis, introduce our guest.
Well, as we mentioned, we've got Dr. Luisa Cikamatana, who's the Deputy Secretary Hospital Services, and Dr. Luisa is here to talk about World Lupus Day. Now, not World Lupus Day because that's actually celebrated internationally, but of course there is an awareness here in Fiji on the disease itself. But a very good morning to you, Dr. Luisa. Thank you very much for joining us this morning.
Good morning, Mavis, and good morning, Tai.
Okay, well, Dr. Luisa, maybe you want to start off by telling us, what is lupus?
Okay, lupus medically is a chronic multi-system inflammatory disorder, but simply put, it's an illness whereby the body develops antibodies.
Right.
And it attacks the cells of the body, mainly causing some reaction in the organs. And antibodies are needed to fight against germs that enter into our body. Right. So it's part of the immune system. So they're called the soldiers of the body.
Okay.
Yeah. So with people with lupus, it's just that the antibodies goes in and attacks the cells, the normal cells in the organs. So you have multi-organ organs involved. And it can be mild, which really sometimes just joint pains, very mild signs and symptoms. Right. And it can go on to the very severe stage where you have what we call the systematic lupus erythematosus, or SLE. Yeah. So a lot of patients in Fiji would remember SLE. So if you say SLE, they tend to sort of, they understand.
Okay. You mentioned, what parts of the body it affects. Well, we've got pictures here that would like to roll, Dr. Luisa, on lupus. And part of it is skin rashes. And typically, what we call butterfly, because it looks like a butterfly.
Yes, it does. That's one of the common ones that we tend to see. So when we see that, that type of rash, familiar rash, we think of lupus, SLE.
Okay. And it affects the blood vessels, of course?
Yes. So a lot of organs, the blood vessels, the joints. So people have joint pain. They can also have swollen joints, more of arthritis. Right. The hair, you can have changes in the hair. There can be thinning and also hair loss. Right. And it's very noticeable around this side.
Okay.
Yes, and it can also affect the heart, the kidneys, the lungs, also the brain. People can have symptoms of psychosis.
Right.
Yes.
And that's when it gets to the brain.
Yes, when the brain is involved. So those are ones that sometimes you really have to find out what's causing the psychosis. And it may be a presenting symptom itself.
So it has various stages. You've got, like you said, the mild stages and then to the more serious stages.
Yes.
How is it contracted?
Well, it's not contagious. So if you have it, you can pass it to the next person. Okay. But research has shown that there's some genes involved, and it's not just genes alone, but you have some triggering factors. So it could be infection, or some drugs or medicines, and also environment like sunlight. Okay. It just triggers it off.
Okay. And Dr. Luisa, I know that this is you mentioned that it's not contageous. That's good news. But who does it mostly affect?
It affects people of all ages, even newborns, but majority of the cases are women of childbearing age. So they affect, 70 to 90% of the cases are women. Childbearing age from 15 to 49 years old, yes, and more common in the blacks than the whites.
Okay.
Yes.
Okay. And how, I wanted to ask how common is it here in Fiji? I mean, we never hear of, but do you get a lot of cases? Or?
We do get cases, but we haven't done research to really see what's our prevalence. Yes, we only have international prevalence rates. Yeah.
But yeah, go ahead.
But it will be, interesting to, to find out. Maybe some, a mile that we don't really register, but we don't really have a register itself.
I just want to run those pictures again, Dr. Luisa. So, if our friends at home and, of course, family and friends are watching this morning, if you actually have developed that kind of rash, which is commonly known as the butterfly rash?
Yes, the butterfly rash.
Then they need to come to the hospital.
Yes, I think they should, There's certain, this is very classical. So, if they have that, they should present to their nearest health center.
Okay, I understand that the Ministry of Health is creating, awareness about Lupus Day, and of course, the day being observed today. What else is being done to create more awareness?
I think the ministry, how we'll also have programs for wellness, and I think it's just, tackling wellness, how we always preach about wellness. Wellness in all body, mind, and soul. And I think I'd like to touch on the 7 gifts of life that we normally promote. That's resting well, having at least 8 hours of sleep. The elderly might need less, the young and more, say about 10 hours. Thinking positively. A lot of us tend to have negatives, but we tend to think positive. It does help us to our bodies. And breathing clean air. Just avoid smoking and avoid breathing in polluted air. Drinking water. We encourage people to drink at least 8 glasses of water. More if you are active or you sweat a lot. And avoid drinking alcohol and kava. And I think that's one thing that we've been preaching, still getting to it, to try and empower people to make the right choice. The 5th one is eating the right time and the right amount of food. And I think this is one area where we tend to forget. We, in the Pacific, love our food. But it's actually the type and the amount. Amount is very important. And I always preach about that. My plate of food. So if you look at your plate, when you start dishing, you make sure that half is veggies or fruits, and the other half you can sort of divide it and says, okay, one part is the protein, which is more of the meat, and the other of your carbohydrates or the root crops or rice. So I tend to use the fist. So that's your portion. So it's easier. Sometimes we have to just use simple things to remind us of how much. And the 6th one is moving the body. At least 30 minutes a day that you try and really move.
Exercise.
Not just those slow ones, but real movement. And the last is to reproduce, and respecting your reproductive organs and use it to procreate, to have children and offsprings. And yes, that's more like the wellness message that we tend to promote.
Well, thank you, Dr. Luisa, for coming this morning and talking to us about this. But so these are the 7 ones that you actually mentioned that would help us in terms of wellness, and act as like a preventative measure for lupus, of course.
Lupus and any other. I think when we talk about wellness, it's more
covers everything.
Covers everything. So.
Okay. Just one more question. I know we jumped straight to the the 7 things, gifts of life you're talking about. Okay, being promoted by the Ministry of Health. The other thing that we wanted to ask, is it curable? Like if one has it, if they do see that they've got symptoms of lupus.
Okay, lupus is not curable, but we have treatment for it, and the treatment, you have medicines to control it. And with lupus, sometimes you get into remission, what we call remission, that you're okay, it's under control, you don't have any signs or symptoms, you're well, and at times it just flares up, and so you become sick, and then how the doctors will have to treat you. So I think my message to those who have SLE or lupus is, for you to know about the disease, so that you can determine the early, signs that you're just starting, so that you can seek early treatment. Yes. And so a lot of times, if you teach people to, try and identify those early warning signs, it'll help. So they present early, and you can sort of, treat it and control it. Those times when they present late, that's where the problem arises. It's too severe, and we really have to advise that we'll try our best and see how it goes.
And I guess, Dr. Luisa, it's important for the family members as well to understand that. It helps the affected
family support is very important, especially for chronic illnesses. There are times when they can be challenging, needing that support, have mood swings, they're sick. So the family needs to, really be there by their side, and also, just understand that it's part of the illness and it's nothing normal. It's not a normal situation, especially in times when they have psychosis. If the family is not understanding, they will just give up. And so, family support is always important.
And should, if we need more information, where can we go to?
All the facilities, health facilities, because if one of the workers are not familiar, they can always refer to the appropriate facility, more the divisional, the specialists. So this is more like specialists who look after them and follow them up in the special outpatients clinic.